Hi guys, and welcome back to my channel PLife, the pharmacist life, bringing you great healthcare advice and tips. Okay, so today's topic is very different, absolutely different, and a little bit of a, do we really need to be knowing this? But I feel like it's of great value, and I feel like it's something that I should share with you guys. So I'm going to just dive right into it. So today's topic is bladder infections. What do I mean by bladder infections? Bladder infections are infections that we get in our urinary tract. So they're mostly commonly known as urinary tract infections. I will be sharing some symptoms and tips on how you can identify if you've got a urine infection and what you can do to relieve it. And then if you notice that the symptoms are getting any worse, you can then go to the doctors to get some medication. First sign and symptoms of urinary tract infection is you get a burning sensation when you go to the toilet. Okay. Second, you have this increased need to go and urinate all the time. So you have an increase in frequency by which you go to urinate. If, for example, you're someone that just goes to the toilet every 3-4 times a day, when you do have a urine infection, you find that you are actually going to the toilet every 10 minutes, every 20 minutes. It can make you go to the toilet quite often. A third symptom is cloudy urine. So you have this cloudy urine looking appearance in your urine. That's another sign of infection, especially, which leads me to symptom number 4, if it's smelly. If it's smelly, especially if it's fishy, smelly, that means that you do have a urine infection. Symptom number 5 is blood in your urine. If you do get blood in your urine, then that's a bit of a worry. Okay, so that would indicate that you've got a bladder infection. So that could also move up to your kidneys if you don't get it treated quickly. So how do we treat these symptoms? These symptoms could be treated, first of all, especially if they're mild symptoms, you can try and sort them out yourself and treat them yourself. If they're severe symptoms and they're really, really painful and uncomfortable, both for men and women, then you do need to go and see your doctor. Urine infection is actually quite common. Okay, we do get 1 in 10 women that come to the pharmacy and men that come to the pharmacy to complain about these symptoms. It is more common in women as opposed to men, okay, because with the women, our bladder, our urethra connecting to the bladder is very small, so it is very quick for bacteria to get into the bladder and affect women, and very, very common after sexual intercourse. So I will advise that if you are a woman and you tend to have infections, especially after sexual intercourse, then either leave me a comment below, see how I can help, or go to your doctors and see if you can get a bit more insight as to how it can be treated. Okay? Also, men, if you notice that you're getting the symptoms as well, definitely use the advice I'm about to give now, and then if it gets worse, go and see your doctor so that you can get some antibiotics. Tips on how you can treat a mild urinary tract infection. First tip is you can use what we call cranberry juice. It's called cranberry juice. Cranberry juice has got very, very good nutrients and vitamins inside it that can help neutralize the acidity or also help fight the bacteria that is in the urinary tract. Tip number 2, make sure you are drinking lots of water. I know it feels like, how can I drink lots of water when I'm peeing all the time? Drink lots of water because you want to flush that bacteria out of your body as much as possible. Some say that you should eat lots of garlic. I know garlic is so healthy, so I am all for having garlic in your diet because there's so much health benefits from garlic. So I'll definitely say try garlic, see how that helps. Okay, you can try some other vitamin C products that can help as well. You can also try what we call probiotics. Probiotics is fantastic. It's really, really good to help protect the good bacteria inside you and help build more of the good bacteria and then flush out the bad bacteria. Now, you say, Elizabeth, I've tried all these things. I'm still getting those symptoms. I'm still getting pain, you know, down my lower abdomen. I'm still urinating all the time. There's still a fishy smell coming out of my urine. There's a cloudy urine. There's blood in my urine. I'm having to pee all the time. There's burning and pain sensation. What do? I've tried all these things and I'm still suffering. What do I do? Okay. I would then say to you, you need to go to your doctors and get some antibiotics. Most of the time what the doctors will do is they will first test your urine. So they would say, give a urine sample, let's test it. They test it, they find what bacteria it is that is causing that problem, and they give you a suitable antibiotics that will fight the bacteria. And that normally, the treatment course should normally take 3 to 7 days. Okay, after 3 to 7 days, you should be happy. You should be like, whoop whoop, I'm feeling lots better. I'm not struggling to go to toilet. I'm not struggling with pain anymore. And that goes for men and women. So those are my advice and tips to you today. I do hope that you've learned a thing or two. Please share this video with your friends and family. Let everybody know, especially if it's going to help them. Let them know about it. Share with your friends and family. Tell everybody you know about PLife. Thank you so much for watching. Like, give it a thumbs up please. Comment below, I want to hear from you. And subscribe. It's here, the box is here, so, or here, when you're watching, here or here. Make sure you subscribe to my channel, guys, because the more people that watch this health video, the more it's gonna go spread, and the more people, which will help so many people. Thank you to all my old subscribers. Thank you to my new subscribers. Thank you guys so much. I love you. Mwah. Have a brilliant week. Lots of love from me. Bye bye.